Have you ever had an internal dialogue in your head, like talking to yourself? Because I had. But sometimes you gotta give yourself little pep talks, all day long, like crazy person, because you're the only one looking out for you, right? Imagine just a normal morning on my way to college. Got my bag, got my wallet, check my phone, check, got my keys. Where are my keys? Oh, okay, got my keys. It's okay. It's gonna be all right. It's gonna be a great day. You got this. I mean, nothing's wrong with a little chit chat with yourself, right? Everyone feels worried, Everyone has anxiety. It's either you're too anxious, kinda anxious, or being in denial. Anyways, that's basically what they are going to talk about in this video. Next slide, please. Generalized anxiety disorder, or in short, GAD. What is GAD? What's the difference with normal anxiety and other anxiety disorders? What are the symptoms? How do we treat it? In this video, we will know all the answers. So if you want to know more about GAD, sit tight and watch this video until the end. First of all, let us six speakers introduce ourselves. We are Salsabila Hanifah Biono, Tesalonika Dias Wijaya, Tiara Putri Kurniawan, Widya Nurya Marsa, Yahya Nur Hakim, and lastly, me, Zafiana Tifal Farisi Pasha. And we are from Group 3, Grade F. We might be just first-year college student in the psychology department. However, we've tried to evaluate some information from reliable sources about this generalized anxiety disorder. One of the main sources that we gain for our speech is an article about GAD from Annals of Internal Medicine Journal uploaded by American College of Physicians. From the article, we knew about the screening, diagnosis, treatments, and practice improvements for GAD. Next slide, please. It's very important to know one or two things about GAD in general. Maybe this knowledge can save the life of a person, even for yourself. Therefore, in this video, we'll talk about generalized anxiety disorder. We'll explain its definition, its difference between normal anxiety and the other anxiety disorders, its symptoms, and last, its diagnosis and treatments. Without further ado, let us begin. Next slide, please.
And the first, we will discuss about the definition of GAD. Next slide. When someone has GAD, that person has frequent or nearly constant nagging feeling of worry or anxiety. Generalized anxiety disorder is characterized by persistent and excessive worry about a number of different things. People with GAD may anticipate the disaster and may be overly concerned about money, health, family, work, or other issues. People with GAD find it difficult to control their worries. They may worry more than they seem about actual event or may expect the worst even when there is no apparent reason to do so. That is why this condition is often referred as chronic anxiety. For them, anxiety is like an enemy that can easily attack under any circumstance. Although it is difficult to calm down, people who suffer from GAD generally can only feel their own worries without being able to express them to others. Whether excessive anxiety will only disturb daily activities. Okay, next.
Okay, as we said at the beginning about the definition of GAD, we will explain the difference between normal anxiety and GAD. The difference is that GAD is chronic and its symptoms are not associated with any specific cause, unlike normal anxiety. The full explanation can be seen in this table. Normal anxiety is worrying about a specific event such as an upcoming work, school, exam, or medical appointment. Meanwhile, GAD is a constant chronic and unfounded concern that causes significant stress, interferes with social activity, and interferes with work, school, or family. If normal anxiety can cause things like difficult relaxing, sleeping, and more, GAD can cause restlessness, irritability, insomnia, or difficulty concentrating for no apparent reason. The next difference is on the side of the cause. While normal anxiety can be caused when dealing with serious problems, GAD can be caused by fatigue that unrelated to any particular physical or emotional problems. The next aspect we're going to discuss is the difference between GAD and other anxiety disorders. Other anxiety disorders are often associated with a specific primary stimulus. You can see from the name itself. Generalized anxiety means the anxiety usually caused by general things and not specific things. So, other anxiety disorder usually can be caused by specific things, events, or themes. For example, the feeling of worry and anxiety of body dysmorphic disorder is caused by flaws in the physical appearance of a patient. The next difference is how the patient reacts to reduce the distress. For example, people with OCD or obsessive compulsive disorder tend to do rituals or compulsion to cope with their anxiety, while people with GAD don't.
And then the symptoms of GAD. GAD have physical and psychological symptoms. For the psychological symptom, GAD can cause a change in your behavior and the way you think and feel about things, resulting in symptoms such as restlessness, a sense of dread or fear, feeling constantly on edge, difficulty concentrating, and irritability. Your symptoms might cause you to withdraw from social contact, like seeing your family and friends, to avoid feelings of worry and fear. You may also find going to work difficult and stressful and may take time off sick. This action can make you worry even more about yourself and increase your lack of self-esteem. And then the physical symptoms of GAD are muscle tension, insomnia, fatigue combined with significant distress, fast heart rate, chest pain, dyspnea, dizziness, or paresthesia. In addition to a throbbing and free-floating worry, you might feel restless and irritable. Your heart might beat faster, your breathing might become shallow and rapid, and your hands might tremble. Rapid, rapid breathing sometimes sets the stage for hyperventilation, having breath accompanied by a sense by gasping for air, faintness, and numbness. You might respire more even without extraction, have trouble swallowing due to dry mouth, and have insomnia. According to the website of health.harvard.edu in 2014. Other physical symptoms such as upset stomach like cramps, nausea, and or diarrhea, headache, and general acne and pain may be so prominent that sufferers and their doctor focus on the physical symptoms and overlook the underlying anxiety. Next slide, please.
Solution. Next. This stop. Sebelumnya the solution of GAD. Last but not least, you might be asking, how do we treat GAD? Before we go to the topic, first we need to know the answer of, do we actually have GAD? I mean, I don't want to doubt you or anything you know this day. Teenagers seem to like to self-diagnose themselves. For some reason, I'm telling you, don't self-diagnose. It's literally a mental disorder you don't want to feel proud of having it, right? That is why let the expert diagnose it for you. The clinicians like psychiatrists or psychologists, if you don't know the difference, congrats, you're living a great life. Anyways, back to the serious topic. To diagnose the generalized anxiety disorder, it should be done by a lot of steps, like examining the symptoms, doing physical examination, and some laboratory tests. You should also be examined about your medical condition, mood, and other anxiety disorder that you might have. Next. Next, please. And then after we are diagnosed with GAD, the clinicians will recommend some treatment. There are two types of treatment. The first one is non-drug therapies, which consists of cognitive behavioral therapy, supportive psychotherapy, psychodynamic therapy, mindfulness, acceptance, and commitment therapy. The second one is drug therapies, which consists of first-line medications such as selective serotonin reuptake inhibitors or SSRIs and serotonin norepinephrine reuptake inhibitors or SNRIs. Second-line medications such as azapirons, benzodiazepines, and anticonvulsant. Third-line medications such as atypical antipsychotics, antihistamine, and tricycle antidepressant. The clinicians would also consider consulting a psychologist, psychiatrist, or other specialist if the diagnosis is uncertain or if the patient cannot tolerate therapy and some other circumstance. Lastly, this is the most important part. You need to remember that your feeling matter. It's common to feel worried or anxious, and don't be afraid to seek mental health care if you're worried sick to the point that it's affecting your life, okay? Next.
Now, to complete what we have discussed in our speech here, the definition of GAD is a person who has frequent or nearly constant nagging feelings of worry or anxiety. The difference between GAD and normal anxiety is that GAD symptoms are not associated with any specific cause. GAD can cause restlessness, irritability, insomnia, or difficulty concentrating for no apparent reason. The psychological symptoms of GAD are restlessness, sense of dread or fear, feeling constantly on edge, difficulty concentrating, and irritability. The physical symptoms are muscle tension, insomnia, fatigue combined with significant distress, such heart rate, chest pain, dyspnea, dizziness, or in serious case, paresthesia. Remember when we asked you whether or not you ever talk to yourself, not like a crazy person talk, because like what we said earlier, it's okay to be a bit worried, it's normal. But keep in mind, you should also be worried about your mental health. Call my apologies. So, after hearing the explanations about GAD above, we should be able to know ourselves that we can keep our mental health and happiness in living our lives. We can take good actions to solve our own problems well. If we can't be solved by ourselves, we can turn to professionals such as psychologists to relieve our anxiety. All right. So, if we know the definitions, symptoms, and difference between GAD and other anxieties, we know how to cope with it, prevent from self-diagnose, and give advice to people with GAD or other anxiety to check and seek treatment from a psychologist or psychiatrist if they are sufferers, and many other implementations. And then, last but not least, thank you all for watching our video. Don't forget about what we have discussed just now. However, whether you want to remember or take our advice, it is all up to you. We apologize if there's an incorrect source or some offending words. See you next time, hopefully soon, and bye-bye.